change the needle to a 22 gauge and 1.5 inch needle. This is applicable to Marjorie because she's an adult, and also when I went over there I did the test of on her latus vastus lateralis. I held my index finger and my thumb on the subcutaneous tissue on her skin, and I picked a needle that's like just slightly bigger than what I measured, and so that's a 1.5 inch needle, and then 22 gauge is good because this these medications are pretty like they're not very, they don't have much viscosity, and so between a 20 so a 22 gauge needle is good pretty much. So I'm going to make the tag to bring in there. So I'm checking these again. So and my patient's name. Drug, so it's gravel. Morphine. Amount. 10 milligrams. Okay. Also, I would have already checked the expiry date on both of them, so yeah, this one's good, 2014, and this one's good. Would have already done that. Okay, so I have these already, and I also would have already checked my medication, so I would have checked like the monograph, so I would have checked to see like the root, like the peak of the drug, the duration of the drug, compatibilities between morphine and gravel, so I would have checked that before I added them. I would have also looked at anything I need to look for. So for morphine, it says for IM injections, administer slowly, rotating injection sites. So when I go in there, I'll be checking for the site to see if there's anything else labeled, or I'll check in the nursing notes to see if there's anything written about where the IM injection has been administered prior. But there is nothing written on the IM injection, so or on the MAR, so she hasn't been given these medications yet. Also, I'll be checking the patient's circulatory, checking for circulatory impairment, or rashes or bruises or anything at that injection site. I'll check for tenderness, and yeah, just any lesions or anything that kind of demote the use of the site. And yeah, so checking for morphine, so I'd look at that, and then checking for gravel. So yeah, checking the dose, all is good. Washing my hands, and go back into the room to give it. Hi Marjorie, I'm back. So have you said that you have had IM injections before, right? Have you ever had them on your on the back of your leg?
No.
No? Okay. So I'm just
Marjorie Lemon.
And your birth date? Yeah, so January 4th, 1979, and your doctor is Dr. Stab, so I see those indicators on your bracelet, so I got you to see your name and your birth date, so we're all good. Okay, so I'm checking the drugs again, making sure I have the right ones. This would have been on the medication. Okay. Alright, how are you doing? How are you feeling about this?
Still nauseous, still in pain.
Okay, so this is just going to be a quick procedure, okay? You're just going to feel a quick burning sensation. Okay, so it's just going to go right here, right in the side of your leg. So now I'm checking again, like I said before, I'm checking for any signs or symptoms of decreased circulation. So if her leg feels cool, if it's blue at all, if it's cold, so I'd be feeling for warmth and stuff. So while I'm kind of measuring, so I'd go from 1/3 below her thigh and 1/3 above her knee, and then I'd go to the outer side of her leg, outer side of her thigh. So be like right in this muscle right here. Yep, so found it. Still doing okay? Marjorie?
Yes, still feeling nauseous.
Okay, this is gonna help. Okay, so I'm starting in the center and then going outwards. I'm gonna keep this on there to kind of mark where I'm gonna put the injection. And I'm moving with the, so I'm using my non-dominant hand to pull the skin to the side, and what that's doing is creating the Z-track method. So it kind of moves the skin so it prevents leakage of the injection and decreases pain. So I'm going to take this little. Dart it in. So now I'm going to aspirate. Oh, I wanted to remove my hand there. So I'm going to aspirate, and I don't see any blood coming in, so I'm going to put it in, slowly administering it over 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, now I'm going to leave it in for another 10 seconds. So 1, 2, 3. Still doing there? Still doing okay there?
Still okay.
Okay. 6, 7, 8, 9, 10. Okay. Okay. So I'll just get you to hold this and put pressure on it for 3 minutes. And since she's not feeling very good and she's nauseous and is in a lot of pain, I'd probably hold this for her just to help her through it, and then yeah. Also, this would have been discarded right away, and that lid wouldn't have been put on like that, but for the sake of it, not a very good place to discard it. That's what's going on right now. And yeah. Alright. Okay. How are you doing? Are you comfortable there?
Yep, that's all I need.
Okay. So I'm going to come check on you in 20 minutes or so, and I'll come see you, come see how you're doing. Let me know if you have any symptoms, if, I don't know, any other pain or anything that's changing, like getting worse or anything. And let me know if you have any difficulty breathing or anything. Yeah, like I said before, these drugs create respiratory depression. So just want to make sure that you're breathing okay and that you're feeling okay. So if you notice any changes, then just let me know. All right. And I didn't actually tell her that the side effects were respiratory depression or central nervous system depression, but I would have, in hindsight, done that to begin with. And yeah, there we go.
Okay.
So I'm going to go chart and then be done.